So a very good evening to everyone. Uh, so let me share with you all my journey as a microbiologist. So I did my MBBS from KMC Bangalore, and after finishing my MBBS, I completed my internship, and then I went home for my postgraduate preparation. So while I was at home, I was preparing for PG entrance exam, and in my first attempt, so I dropped a year, and in my first attempt, I could not clear. I could not get a good enough rank. So I dropped another year, and again I wrote the entrance. And even in my second year of drop, my ranks were not good enough. So to be very honest, in the beginning, I had never thought of, taking microbiology as a specialization, like never imagined, to be honest. And so we all begin with, our clinical subjects as a priority, and then come a paraclinical, or they are never a part of our list. So that is how it was for me. And then, so after my second year of drop, and then even then, when my ranks were not good enough to get a good clinical branch in a good college, so that is when I decided that okay, fine, I will explore my options at this particular rank, and I will take whatever I get. And what I believe then, and what I still believe, is that it really does not matter what branch it is. It is more about what you make out of it, right? So branch, it could be clinical, it could be paraclinical. Perhaps these are some tags that we have given to the branches. It's all science, it's all related to the human body. And I don't think it's right, or it's justified to discriminate, or to designate branches of medicine. So each branch has its own importance in patient care. Each branch has its own value, and it's we who have actually divided them into various categories. So I was so I decided to explore my options at that particular rank, and the best available option at that point in time was MD microbiology at KMC Manipal. So I also, had a discussion about it with a few of my seniors, and they all advised me to go for it because, first of all, since it's not a very popularly chosen branch, the competition for job opportunities later on is not as much, or the saturation, as you would call it, is not as much as compared to other clinical branches or other, various other branches. So that was one, reason why everybody was like, okay, fine, you can go ahead for it, because later on, finding a job wouldn't be that difficult. And also, to begin with, I did not have any interest in the branch, because what you read as an MBBS student in your second year, or what you read during a PG preparation, is very, very superficial. And also, microbiology is not a very important subject, because you have other things to study, like medicine, surgery, and gynecology, and other stuff. So not everybody pays a lot of attention to it, and neither do we study in so much depth. And it's very superficial. It's a lot of rote learning. So we hardly have any idea about what microbiology exactly is, and it really doesn't make sense when you're in your when you were an undergraduate. So that is how it was for me. I was least interested as an undergraduate, and still I was confident that okay, whatever branch I take, even though I'm not interested into it, I will still make the best out of it. And I will still, there's something called as developed interest. So even you may not be inherently, inclined towards something, but you can always develop interest for it. So I somehow believed in that. Some may want to differ here, saying that unless and until you're inclined towards something, or unless and until you have that innate inclination towards something, you should not go for it, and it can be a disaster or whatever. But No, in my case, I was not inclined towards it, and I developed interest into it. I definitely became really passionate about it, and I am very passionate about it right now. But when I opted this subject, I was not interested in it. So yet I was confident that okay, whatever life is giving, okay, take it and make the best out of it. So with that hope and with that thought process, I joined my PG college, and so I went to Manipal. Well, since I had already done my MBBS from there, so obviously I always wanted to go back to that place. And it is an amazing place. It has a lot to offer in terms of academics, in terms of social life, in terms of everything. So it's actually an amazing place to learn and to grow. So I went to Manipal, and my 3 years in Manipal was an amazing experience, I would say, academically and socially and otherwise, because first of all, it was a great learning experience. So, during my 3 years, what I realized was, I would just share it in a gist form, that first of all, when you what you study as a undergraduate is very different from what you study as a PG. You for 3 years you are just studying one particular subject, and you study so much in depth, and you study in depth and breadth. You study a huge volume of that subject, and in a lot of depth. So you so it gives you a different insight altogether. And I realized that after so everything that we do in microbiology has a very, very scientific reason. For example, something as simple as a gram stain. Each step of gram stain, even when on a slide we make a smear, whatever sample is sent to the laboratory, so we make a smear out of it, and then we stain it, and the staining is a 4-step process, and each step has a scientific reason. And it is so important to follow the process, that even if you miss a step, you can make blunders. So each and everything that you do, however small that may be, has a huge significance, and it has a huge scientific relevance. So that you realize only when you study it in so much depth, and you're just amazed that it is so beautiful. And science is actually beautiful because it just amazes you all the time. And that's what every medical branch is. You just cannot say that because it's a paraclinical branch, you just cannot underestimate it. It has a lot to offer. It's just that we don't know about it. So that's what I realized. And it's we just call it paraclinical because the general perception is that you stay in the lab and you are doing a lot of bench work, but that's not true. During my JR-ship, we would go and see a lot of patients. We would interact with patients as well, and so it's more of clinical microbiology. And apart from a lab routine work, so we would at least spend 2 to 3 hours per day in the ICU, interacting with the patients, interacting with the treating team, and we had a lot of say in what all antibiotics need to be given for a particular case, what all samples can be sent, what all further workup can be done if it's a case of any infection. So, and we would suggest on dosage of antibiotics, on infection control policies of the hospital, uh, escalation, de-escalation of antibiotics, and a lot of other things. So that would be really satisfying, because so many times the physicians are so busy with uh, treating the patient, or treating the disease, that they miss out on small things. For example, on what is the correct dose of antibiotic that's going on, whether the antibiotic now needs to be escalated or de-escalated. These are small things that are sometimes missed out by the physicians. And as a microbiologist, you can, if you're a part of their treating team, you can definitely take care of such small things. In ICUs, you have patients of sepsis, and you can help them find the source of sepsis, whether it's the central line or whether it is a urinary catheter or whether there's a wound which is acting as a source of infection, and if that source of infection also needs to be treated. So there are a lot of things that a microbiologist being a part of the treating team can contribute. So that's how my junior residency was at Manipal. And we played an important role in the treatment of the patients, and it never felt like a paraclinical branch at all, and we had a lot of say in the patient treatment. So we had a lot of say in the patient treatment, and it was a very, very gratifying experience as well, because when you see patients recovering, when you see the wounds healing, and when the patients are coming out of sepsis, it's actually makes you feel good that you could contribute to patient recovery in some or the other way. And also the physicians, all diagnoses are made in the laboratory. So it's so they also depend on the laboratory for a lot of reasons. And it's actually a lot of teamwork that happens. So lab cannot function separately, and the physicians cannot function separately. So it has to be a teamwork, and that's what we need to understand. And one of the challenges that I realized only after, as a microbiologist, was that as an intern, what happens is you're told to take a sample, okay, and send it to microlab, and then you don't realize how much time a particular report would take, how much time an aerobic culture would take, or how much time a fungal culture is supposed to take, because it's not the chemicals. It's not the chemicals that you're identifying in the blood. It's not like biochemistry that you identify a particular chemical and then you give your report. You are dealing with live organisms here, and live organisms, you need to cultivate them in the bacteria. Those bacteria need to be cultivated in the laboratory. So they take time, and since they take time, it can, the reports vary from 24, 48 hours, and then once they grow, you need to identify them, and then after identifying, you need to do the sensitivity testing and other things. So all these things take time. Even if you're looking for fungal growth, the fungal culture, it can take up to weeks, or if it is TB culture, that can also take up to weeks. So all these timelines and small details, as an intern, you're really not aware of, and you're told to just call up the lab and find out why they're not reporting and why is it taking so long. All other reports are ready. Why is microbiology lab delaying the report? So this is a communication gap that exists between the clinical our clinical physicians and the laboratory, and this definitely needs to be addressed. And even myself as an intern, I would never be able to understand why microbiology reports take so long, and why there is no growth, or why there is contaminants reported. I would never understand. But then as a postgraduate, yes, I realized that there's a gap that needs to be addressed. The physicians need to be told that what happened, or they need to understand what exactly happens in the laboratory, and how much time a report takes and why it takes, and what all we do. Because it's not nobody, first of all, we spend a lot of time. We work really hard towards getting an appropriate report for the patient. So that, but just because it's not visible to the outside world, the gap exists, and not everybody understands, right? So this is something that needs to be addressed. This is something, this is sort of a challenge for a microbiologist as well, because sometimes it's not that you're on purpose delaying the reports, but this is how it is. The organisms are not growing, and you cannot really do much about it. Sometimes the organisms just don't grow. Sometimes you have fastidious organisms, and they take their own time to grow, and you just cannot report, you just cannot report it any faster. So these are few things that I feel need to be addressed. And as far as microbiology as a subject is concerned, it's actually very, very interesting. The more you start reading it, the more you start enjoying it. And that is what happened with me personally. And I started loving it. Like, I developed a lot of passion for the subject, only because, once you start reading, and then you start understanding, and then you're so amazed by the science behind it, by the scientific reasons behind everything that we do, that you realize, okay, fine, it's actually very interesting. And it's interesting to study about those living organisms that we are not able to see with our naked eye. And they also have a world of their own. And, it's actually amazing how uh, the bacteria, how they develop antibiotic resistance, why they develop resistance, why the virus behaves in a particular way, why a particular virus would infect only a particular system, why it wouldn't affect the other parts of the body, why only it has a predisposition towards only a particular system of the body, why we have fungal infections, and so many things that it actually gives you a different insight into it. And that's how it was. And my journey was actually it was a beautiful journey. Enjoyed thoroughly reading about it, learning more and more about it, and seeing so much of it. And every day, it's it's a different challenge, because the bacteria that you would so every day when you're reporting, and those agar plates, so agar plates, when you're looking at them, you so every day you can just expect a different bacteria. Sometimes it's just so different, you really don't know what it is. And that is when you try to identify it, and you're curious throughout, and there's some sort of suspense that prevails, that okay, what could it be, is it some new bacteria that we're looking at, or is it some old bacteria that is presenting in a different way? So there's a lot of anxiety and curiosity in a good way that's involved. So that is what makes you look forward to it each day. And that's how it was. And after so you so what the thought process that I had entered the field with was that, okay, whatever it is, I will make the best out of it. I will develop interest for it, and I will uh, just what it's always said, that whatever branch you pick up in your masters, you just marry the branch. So I actually decided that, okay, fine, this is whatever it is, I will stick to it. And that is what happened. The more and more I read about it, the more and more work I did in the lab, and during my PG, I actually developed a lot of passion for the branch. I developed a lot of respect for the branch, and I enjoyed it, and I it was a great experience. And so this is what I would want to convey to all the aspirants here, that it really does not matter what branch it is. It does not matter at all. It depends on how you deal with it, what you make out of it. So it could be a clinical branch, it could be anything. Whatever you take, make the best out of it, give it your best, give it your heart and soul, and good things will come to you for sure. So it's not about how much money you're going to make. It's not about how popular you're going to become. Just put in your hard work, and once you put in your hard work, once you give it your best, other things just follow. So that's how it is. And so after I finished my JRSHU, I so then I had few options. One was uh, doing senior residency. So as far as scope after MD is concerned, so yes, you all of us have a few options. One is senior residency, or you can pursue in a government institute or a private institute if you love teaching. And I think all doctors should enjoy teaching, because it's an important part of the profession as well. So that is one option. Another would be, if you are interested more into academics and education, so you can further pursue. And fortunately, we have more and more options now. If you want to pursue a DM in this, So there's DM infectious disease, which is available at AIIMS Delhi. So eligibility for MD microbiology at for DM infectious disease is only at AIIMS Delhi. And other options are, you can do PDCC. So PDCC is also quite an, upcoming thing right now. PDCC infectious disease. So initially it was at SGPGI in Lucknow, and now it's also at AIIMS Jodhpur and ILBS in Delhi. So these are few institutes where you can pursue PDCC. It's a 1-year course, and it gives you an added degree, and also an added learning experience. So that is one thing that can be that's another option. And then if you're interested in research, you can go for PhD. There is MD and PhD together 6-year course that's available at KGMC in Lucknow. Also, you can pursue PhD, which is available at KGMC as well, and also at SGPGI in Lucknow. These are few institutes that I know about, which was available, or maybe there are few changes as of now. And also, if you just want to, do your clinical work and laboratory related work, you can also explore the corporate options. So that is another thing that you can check out. So these are few options which are available. And apart from microbiology also gives you the freedom to have a work-life balance, because invariably your work hours are quite fixed. It's mostly a 9-to-5 job, or maybe just 8 hours in a day is what you need to invest. And rest of the time you can pursue other things. If you have certain hobbies that you want to explore, or personal life, or you get time for other things as well. So that is another good thing about the subject, that it allows you to have a flexible work-life balance. It allows you to have a good work-life balance and a flexible routine. So you really don't have to compromise on a lot of things. You work, and as far as pay is concerned, in most of the government and private institute, it's the same as your clinical colleagues. So there is no discrimination at all when it comes to the amount of money that you would be earning, or your pay. So it's the same for everybody. And it also, at the same time, it allows you to have more time for yourself, for other activities that you would want to do in life. So yes, it's actually a good balance of a lot of things. So that is another good thing about the subject. And so yes, I chose, so out of the options that were available, I chose to do an SRship. And because I enjoy teaching, I wanted to be a part of a teaching institute. And yes, also 3 years of SRship is mandatory post MD. So I decided to explore my options for SRship. And then I wrote my AIIMS entrance, and obviously I did not get through AIIMS in first attempt. And also at that point in time, I had this sort of determination that I want to do my SRship only from AIIMS. And I kept trying my first attempt, and then this was my third attempt after 1.5 years that I got through SRship in AIIMS, because first of all, the seats are very little, and also being an outsider, not being an AIIMSonian, it's a little difficult to crack the entrance exam. So yes, but if you want to do something, and if you're determined and if you're adamant to achieve it, somehow you just achieve it. Like, your hard work, somehow it pays off, and it's only a matter of time. You just have to be a little patient, but you have to keep working towards your goal. Like, if at that point in time I decided that I want to go to AIIMS Delhi and do my SRship from there. So irrespective of the failures, I kept working towards it. I wrote my exam for the first time and it did not clear. And a lot of people would tell me that it's very difficult to clear AIIMS and you will not get through. And have you even ever been to AIIMS? You are aspiring for something that you don't have any clue about. And yet I was determined that no, I will keep trying for it. And then I wrote the exam for the second time, and again I did not clear. And again, same thoughts, you will not be able to do it, and it's the second time that you've not been able to clear. It's very difficult, nobody can get through. But again, I was determined to keep trying till I get through. So then again I wrote the exam, and fortunately there was that time there were 2 seats, and I got through. And yes, so what I believe in is that if you're determined, if you really want to achieve something, and you just keep working towards it, irrespective of what everybody is saying, or irrespective of what negative thoughts come to your mind, if you just keep working towards it, one day you will get it. And all your hard work pays off. All your hard work, trust me, everything pays off. It may not pay off immediately, but it does come back to you. It comes back to you in ways that you can never imagine. And also, it's only a matter of time. So yes, this I'm telling you out of my own personal experience, that hard work never goes waste. It never goes waste, and you should, keep working. Never stop working. Keep working, and one day, yes, your dreams will get fulfilled. Have that belief in you. So yes, so I cleared my AIIMS entrance, and so now I'm here. It's been 2 years. I'm in my third year of senior residency here. So yes, it's been a great experience here as well. AIIMS gives you a different learning opportunity in terms of there are different diagnostic facilities that are available, which are not available in most of the institutes in the country. There, in terms of research, there is a lot that you can do. The faculty and staff, everybody is very, very cooperative and helpful. And there's a lot to learn here as well. So in terms of policies, in terms of research, in terms of laboratory work that we do, there's a lot to see and learn. So if you guys also have that kind of aspiration, do go for it. AIIMS is not that difficult at all. It's just about your persistence, how persistent you are, and how much hard work you're ready to put in. And anybody can do it, trust me, anybody can do it. Because it's not like, if you're from a government institute, or if you've been in AIIMS, only then you can pursue other further courses in AIIMS. It's nothing like that. Anyone can do it. It's just, you should be willing to do it, basically. So yes, that is one thing. So that was my journey so far. And okay. So as far as the challenges in microbiology, I think I've already discussed with you all. Another thing that I would want to stress on is the samples that are sent to the laboratory, the kind of samples. So there's a basic lack of knowledge in terms of what kind of samples that should be sent to the laboratory, and how those particular samples need to be collected. For example, I'm sure all of you know what a gram stain is, right? And then but mostly what we receive in the lab is cultures. So, but a gram stain, a culture would take definitely a lot of time, and in that process, the patient treatment is delayed. However, a gram stain is a very simple test to perform, and also it does hardly takes any time, but it can be quite informative. At least you can know if it is a gram positive or a gram negative. So that can help you, decide on your antibiotics, empirical antibiotics at least. So initial diagnosis definitely can be ruled out, because if we see gram positives, you can start on such antibiotics which work on those gram positives, and neglect the gram negative antibiotics. So this is one thing that needs to be addressed. So this again is a challenge, because it's because of the communication gap that exists between the laboratory and the clinicians. So they need to communicate. It's like a teamwork. Everybody needs to communicate. We all need to understand that we cannot function in absence of each other. So communication is important. Interaction is very, very important. And also, as far as scope or role of a microbiologist per se is concerned, not job wise, like otherwise as a microbiologist, it is definitely increasing by the day, because thanks to the COVID pandemic, there was a lot of it just generated a lot of demand for microbiologists and microbiology testing laboratories, and also otherwise, especially in areas of antimicrobial resistance, because there's a lot of resistance that we with respect to antibiotics that we have to face on day-to-day life. So even in that case, the role of microbiologist plays a very important role. And yes, so these are few areas where a microbiologist has a lot to contribute with respect to antibiotics, with respect to diagnosis of newer infections, antibiotic resistance, also antibiotic policies of the hospital. So these are a few areas where you can find find yourself contributing to. So this is one thing. Another thing is future prospects. So future prospects, I've already shared with you. If you're interested in teaching, for that you have to be really good with the subject, obviously. So that is one thing. You can join as a senior resident in an institute, a government or a private institute. If you're more into clinical work, you can explore your opportunities with corporate sector. Also, you can start your own lab as well. If you have that kind of business acumen, you can definitely start your own lab. You can hire a pathologist and a biochemist, and you can have your own diagnostic center. That is also in demand, and that is also a very, very good option. So that is one thing. Another is, if you want to, education wise, if you would like to go further, so yes, there are PhD DM infectious disease. Also there's DM in virology, that is that can be pursued at CMC Vellore. So that is another thing that has also been recently introduced. So there are newer things coming up day by day. And yes, people are definitely realizing the importance of this subject, which had been neglected for quite some time. But you just really cannot neglect microbes. You cannot ignore them. You just cannot underestimate their capacity to wreak havoc. We have the COVID pandemic that has set a huge example, that you just cannot underestimate the microbes that we are not able to see with naked eye. So they have huge capacity and potential, and for that, studying about them, reading about them, and knowing in depth about them is very, very important, and hence the importance of microbiology as a subject. So yes, that these are the few options that are available in India. Also, if you would want to explore options abroad, there are few observerships, fellowship programs that are available. You can also do FRC path if that is what you would like to explore. So this is, and also microbiology, only in India it has been considered as one of the paraclinical, non-clinical branches, but outside India, no. Microbiologist forms a part of the treating team, and microbiologist is they always have a say in with respect to infection control and antibiotics and antibiotic dosage and the samples that need to be sent and other laboratory work as well. So they play a very, very important role, and they are not considered as only those who are confined to the laboratory. So yes, abroad there are definitely a lot of options, and it is as good as a clinical branch as well. So well, in the end, I would just like to say that do give it your best, whatever branch it is, give it your best and try to stand out. And also, just put in your hard work. Do not think about what you're going to get in return. Just keep working towards your goal. Set your goals, set your priorities right, keep working towards your goal, and do not think about the outcome. It will come to you. It will definitely come to you in ways that you would have never imagined. And whatever branch it is, just love it. Just love it, enjoy it, read about it, do your work diligently, and you will be doing wonders. You will definitely be excelling at it. So given your hard work, given all heart and soul, everything, and yes, good things will come to you. So yes, on that remark, I would like to conclude my talk here, and I would be happy to take any questions that may follow after this. So thank you so much for your patient listening. Thank you so much.
Thank you, ma'am. That was a wonderful session. You were very student friendly, down to earth, and we are very happy to have you in this session. So we may move on to the Q&A session for now.
Yes. Sure.
I think there is a question from Dr. Sanjay Kumar Srivatsava. He's asking. They said coronavirus spread by explosion at virology center at Wuhan. How can we prevent such mishappenings in the future?
Okay, thank you for that question. See, first of all, we're not really sure about it because it's not been scientifically proven, the origin of the virus. There are theories definitely about where the virus could have traveled from and what was the reason for that kind of explosion. So in a virology lab, when a virology lab is established, we have a lot of precautions that need to be taken care of so that such mishaps do not happen. And, there are biosafety levels that are taken care of. So such things usually do not occur. However, at this point in time, we really don't know what was the cause. So prevention is the utmost priority that is ensured in every lab anyhow. So in this case, since we're not sure what was the reason for that kind of explosion, I'm not really sure how, since we do not know, I'm not sure how this would have been prevented, because anyways the prevention of any kind of explosion or any kind of spread of virus from the laboratory to the community has to be ensured and is ensured by every laboratory. So that, I hope that answers your question.
Thank you, ma'am. Ma'am, we have one question. Like, what would be the pay scale if someone is completing microbiology, and what is the scope of growth in terms of financial status post MD microbiology?
Post MD, so freshly passed out student. So,
Yes.
so what I would, okay. So what I would like to share here is that if you, so post MD is, you are going to pursue your SRship, right? So during your SRship, it is equal. So if you join a government institute or a private institute, it is as much as a clinical, as per the government residency scheme. So government residency scheme is applicable. It's equal for all MD students, for all MD, MS students, clinical or paraclinical. So it's the same. And it depends on if you're in a central government institute or in a state government institute. So somewhere, if you ask me in terms of numbers, it would be somewhere around maybe first year of JRship would be somewhere around 95 to 1,10,000, something in that range. So that is in an institute, and in a corporate setup, yes, pay scales are not same. So in an institute, it's the same because it's the same scheme, residency scheme that applies to everybody. But in a corporate, it is different. It is a little less than the clinical counterparts because they have a different system of evaluating them and a different system of paying, because it's more about how much so how much the diagnostic part is contributing to the hospital earnings perhaps. So there it could be a little less, but not, it's just maybe 5-10,000 lesser, not much more than that. So this is how it is, and it's invariably the same as with respect to your clinical counterparts. So there isn't a difference at all for that matter. I hope that answers your question.
Yes, ma'am. Thank you. One more question in the chat box, ma'am.
Okay.
What about the online fellowship courses for infectious diseases post MD? Hello.
Yeah, so there are a few online courses, maybe for 6 months or 1 year, which are available online. but they are, as far as my little knowledge is concerned, they are offered by the few corporate hospitals. I wouldn't want to name them, but a few corporate hospitals offer such kind of fellowship courses. But the only thing is, you can definitely go for it because it adds to your knowledge. You will be definitely learning new things. But as far as your practical experience is concerned, they don't have much to offer with respect to online courses. It will give you an added degree for sure. Also, the whether those degrees are recognized or not is again a question, because most of these fellowships that are offered online are not recognized by any authority. They are not well. These are not, you can add them to your name, but they may not fetch you anything much as far as recognition is concerned. But yes, there is no harm in pursuing it per se, because it will definitely consider it in terms of what it's going to, whether it's going to give you something major in terms of recognition. So no, they don't. The online courses, they don't.
Okay, ma'am. Thank you. And one more question, ma'am. While choosing a college, what are the points must be taken if a post MBBS student is going to take microbiology as their post graduation?
Sorry, what are the points?
Ma'am, what are the points that must be taken by post MBBS students while before choosing institute for pursuing their MD microbiology?
Okay, fine. So first of all, what you need to be sure about is how well equipped the laboratory is. You cannot pursue your MD from a very, very remote peripheral area where diagnostic facility in the institute or in the laboratory are not up to the mark, So that is very, very important, because if there are no tests happening, or if there is very little work happening in the laboratory, your practical skills will be absolutely zero. You will have no idea about anything practically. Theoretically, yes, if you read the books, you will have a good idea, but practically, you will actually know nothing. So it's important that you know how well equipped or how well established the department is, how well established the laboratory is. So it could be a private institute, it could be a government institute, it really does not matter. What matters is the infrastructure. What matters is the variety of tests, the plethora of tests that the lab has to offer, and the diagnostic variability that exists in that particular institute. So that is important. It is not important whether it is a government or a private institute.
Thank you, ma'am.
Any more questions? Okay.
Ma'am, so we come to the end of the session as
Okay.
we don't have any more.
Sure. If there are any more questions, you can definitely email them to me, or you can WhatsApp me, and I will be happy to take any questions further ahead of this.
Thank you so much, ma'am. With that, we come to the end of today's session. It's my greatest pleasure to thank each one of you who gathered here on this evening. First and foremost, I thank Dr. Abul Hassan sir for joining in his busy schedule. My sincere thanks to Dr. Manali Agarwal ma'am for such a wonderful session and giving us a very productive evening. Thank you so much, ma'am. My special sense of gratitude to Dr. Venkatesh Karthikeyan sir, who ensured the smooth flow of events not only now but for every webinar. Last but not least, I thank each and everyone who registered for this event and this as a grand one. Thank you all. With this, we close the session. We have many more to come. Thank you for now. Have a good evening ahead. Thank you.
Thank you. Thank you so much.
Thank you, ma'am.
Thank you, everyone. Thank you for extending us the opportunity to host the session. And I hope you had a seamless experience. Looking forward to host you again. Thank you so much. Have a nice day.